Welcome to the deep dive. Today, we are taking a torch into what can be a very dense and sometimes deliberately confusing topic, vision supplements.
Oh, absolutely.
You see countless bottles on the pharmacy shelf, all promising to guard your eyesight. But how do we, as consumers, figure out what's actually based on solid science versus what's just marketing hype?
That is precisely our mission today. We are going to cut through all of that noise using the most current, evidence-based guidance we can find.
Okay.
We want you to walk away from this deep dive knowing three things: what works, who it really benefits, and I think most importantly, how to check that the product you buy is actually high quality.
That it has what it says it has.
Exactly.
Okay, so let's unpack this from the beginning. People generally seek these out for, it seems like, three core reasons based on the research.
Right.
They're trying to fill, genuine dietary gaps, support their eyes against age-related decline, or they have a specific risk factor. Something like a history of smoking or a diet that's low in fresh produce.
And if you look at the typical user, the focus, it really lands squarely on older adults. We're talking about individuals who have either been diagnosed with age-related macular degeneration, that's AMD, or have a family history that puts them at a pretty significant risk.
But you're right, the net is wider. It includes anyone, even younger people, on really restrictive diets, right?
Yeah, vegans, vegetarians, or just, someone who maybe doesn't eat a lot of fruits and vegetables in their day-to-day life.
So when we talk about the key nutrients, we're not just talking about a generic multivitamin. We're talking about very specific components that do a very specific job inside the eye.
That's right.
If we were to zoom right into the retina, what are these micronutrients actually doing?
Well, we have to talk about lutein and zeaxanthin. They are carotenoids, and they're remarkable because they are physically deposited in the macula of your retina.
Wow.
What's fascinating is their dual function. They act, quite literally, as a natural filter, absorbing and scattering potentially damaging blue light before it can even hit your photoreceptors.
So they're like a pair of internal biological safety goggles.
Exactly, a perfect analogy. But they don't stop there. Their second and equally vital function is to combat oxidative stress.
Okay.
I mean, the retina is just incredibly metabolically active. It's constantly exposed to light and oxygen, which creates free radicals.
Oxidative stress?
And lutein and zeaxanthin are potent antioxidants that neutralize those free radicals right at the source, helping to protect that delicate cellular structure that lets us see.
That immediately brings us to the scientific foundation for this entire industry. You simply cannot discuss vision supplements without talking about one massive research project. The ARDS trials.
The age-related eye disease studies, or AREDS and then later AREDS 2, are the standard bearers. I mean, they were huge randomized clinical trials.
Right.
They scientifically evaluated whether a specific high-dose combination of vitamins and minerals could actually slow the progression of moderate to advanced AMD. The results are why these specific formulas exist today.
And before we dig into the formulas, let's just quickly touch on regulation, because supplements aren't treated like prescription drugs. That's a huge difference.
Oh, it's a crucial distinction. In the United States, supplements fall under the DSHEA framework.
The Dietary Supplement Health and Education Act.
Right. And what that means is that manufacturers are generally responsible for ensuring their product is safe and accurately labeled before they sell it. The burden of proof is mostly on the company itself.
So it's a bit of a trust system.
It can be. Now, if we look over in the European Union,
The framework changes.
it changes a lot. The ESA, the European Food Safety Authority, has a much more centralized role. They govern and approve health claims before they can even hit the market. So the takeaway for you as the consumer is because oversight can be lighter, especially in the U.S., you have to rely on external quality checks.
Which we will get to.
We will.
So, back to the research. The shift from the original AREDS formula to AREDS 2 was a major, major decision. The first formula had vitamin C, E, zinc, copper, and critically beta-carotene, but that changed.
It did. The key refinement of AREDS 2 was replacing that beta-carotene with the carotenoids we just discussed, lutein and zeaxanthin.
That seems like a big deal. I mean, why switch out a core ingredient like beta-carotene? What was the risk they were tricked to solve?
It came down to a very important safety consideration. Researchers realized that while the beta-carotene formula worked, high doses were linked to an increased risk of lung cancer, specifically in people who were current or former heavy smokers.
So it wasn't that beta-carotene was ineffective, it was that it made the formula potentially dangerous for a big part of the target population.
Precisely. And the really beautiful part of the ARED S2 refinement was that lutein and zeaxanthin got the same clinical results, slowing AMD, but without that critical smoking-related risk. It just made the formula safer for a much broader group.
That's why it's the gold standard now.
That's why.
And they weren't just thinking about that. They also had to deal with the sheer quantity of minerals, specifically that really high zinc dosage.
That's the critical balancing act they had to figure out. The ARED-S2 formula calls for a huge amount of zinc, 80 milligrams a day.
Which is a lot.
A huge amount.
Yeah.
And while you need that for the therapeutic effect, taking that much zinc long-term can severely deplete your body's stores of copper.
And what happens then? What does copper do?
Copper is essential for red blood cell formation and nerve function, so it's not something you want to be low on. To counteract that, the formula was carefully balanced by adding just 2 milligrams of copper.
So that's the full lineup.
That's it. Vitamin C, vitamin E, zinc, copper, lutein, and zeaxanthin at those specific doses.
And to be crystal clear for everyone listening, this isn't a general multivitamin. This is a very targeted formula for people at high risk for AMD, and it absolutely requires the oversight of an ophthalmologist.
Oh, non-negotiable. This is
Right.
therapeutic dosing. Only a clinician can say if this formula is right for your specific situation.
Okay, now that we know what we need, let's get into the practical side. Dosing, and maybe more importantly, absorption. Let's start with lutein and zeaxanthin again. What are the numbers to look for?
The target daily dose from the study is 10 milligrams of lutein and 2 milligrams of zeaxanthin.
10 and 2.
10 and 2. And if you're trying to get this from food, you want those dark, leafy greens like spinach and kale, corn, and also, funnily enough, egg yolks.
Now here's where it gets really interesting, because you can take that perfect 102 dose, but if your body doesn't absorb it, it's just a waste of money. We're talking about fat-soluble nutrients.
This is probably the most critical piece of consumer advice we can give. Lutein and zeaxanthin, and vitamin E for that matter, are fat-soluble. They need fat to be properly dissolved and absorbed by your body.
So if I take my supplement first thing in the morning with, say, a black coffee and a glass of water, I'm pretty much wasting it.
You might be missing out on a huge percentage of the benefit, yes. You really need to pair it with a meal that contains some dietary fat. You know, a little avocado, some yogurt with nuts, even just your standard breakfast with eggs.
That is so actionable, and some companies are trying to solve for this, right?
They are. You'll see some products with emulsified or lipid-based delivery systems. They're basically pre-packaging the nutrients with some fatty acids to help with uptake, which is pretty smart.
Okay, let's shift to another big one, even though it wasn't required in the core ARVEs2 formula, omega-3s.
Right. Omega-3s, specifically DHA and EPA, are still incredibly important for overall eye health. They support the structural integrity of retinal cell membranes and help manage inflammation.
What kind of dosage should someone be looking for there?
A supportive dose is usually somewhere in the range of 700 to 1,000 milligrams of combined DHA and EPA daily. Clinicians often recommend them, especially for things like dry eye.
And sourcing is a big deal here, especially for conscious consumers.
Absolutely. The main source is, of course, fish oil. But for vegan and vegetarian consumers, there are now highly effective algae-based alternatives for DHA.
Which is where the fish get it from in the first place.
That's right. But no matter the source, you have to pay attention to quality.
What are the big quality issues to watch out for with these oils?
2 things: oxidation and contaminants. Omega-3s go rancid really easily. They're fragile. So you want products packaged in opaque, sealed, soft gels, maybe with enteric coatings. And second, contaminants like heavy metals. A quality brand will always have third-party testing for that.
Okay, and just to complete the ARED-S2 picture, let's quickly recap the other 2 antioxidants in that core formula.
That would be the big doses of vitamin C at 500 milligrams and vitamin E at 400 IU. They all work together synergistically to form this comprehensive shield for the retina.
All right, moving on to safety. This is a huge discussion because these supplements at these doses, they're not inert. They can and do interact with other medications.
This really raises the question.
Right.
Who needs to be extra careful? We're dealing with very high doses. For instance, both high-dose omega-3s and that 400 IU of vitamin E have a known potential to interact with anticoagulants.
Blood thinners.
Exactly. So anyone on a medication like warfarin absolutely has to consult their prescribing doctor before starting one of these formulas.
And the zinc. that 80 milligrams of zinc also has its own specific risks beyond just the copper issue.
It does. It can interfere with the absorption of certain types of antibiotics like fluoroquinolones and doxycycline. So if you're on a course of antibiotics, you need to pause the supplement or space the doses hours apart.
It's not just a pill you can take and forget about.
No. Long-term use requires monitoring by a healthcare provider to make sure everything stays in balance.
Okay, this sounds complex. For the average person standing in the pharmacy aisle, how do we cut through all this and make sure we're buying a quality product? What's our quality checklist?
When regulation is a bit loose, independent verification is your best friend. You should be looking for evidence of third-party testing.
Okay, what does that look like?
It's a seal on the bottle from an organization like USP, that's the U.S. Pharmacopoeia, or NSF International. That seal is your guarantee that the pill actually contains what's on the label in the right amounts and is free from contaminants.
And without that seal?
You're just taking the manufacturer's word for it, which is a risk.
What about manufacturing standards?
You should look for adherence to GMP, good manufacturing practices. It means they're following federally enforced guidelines for quality. And finally, the label itself has to be transparent. It needs to disclose the exact forms and doses, not some vague proprietary blend.
And we're seeing more formats now. Capsules, soft gels, gummies. Does the format matter much?
You know, it often comes down to what people will actually take. Soft gels and capsules are the standard. Gummies are popular, especially for older adults. But you have to be mindful that they usually have added sugars and may not even be able to fit the full dose of minerals without becoming huge.
Right. Okay, looking forward now to our last section. What's new in Vision Nutrition beyond these foundational ARDs formulas? What are the emerging trends?
We're seeing a really intense focus on making the nutrients we already know work better. A major trend is bioavailability advances. We talked about emulsions for lutein, but that science is constantly being refined to make sure your body can use every last milligram.
And that ties into the bigger consumer demand for clean label?
Absolutely. The push for transparency means manufacturers are scrambling to minimize artificial additives, fillers, things like that. There's a huge focus on clear sourcing, which then feeds right into the trend of sustainability.
How does sustainability play into vision supplements?
It's largely driven by the omega-3 conversation. I mean, the consumer interest in algae-based DHA and EPA is massive because it takes pressure off wild fish stocks. People want to know ingredients are sourced responsibly.
But the truly game-changing trend, I think, has to be personalization.
Personalization is the next frontier, without a doubt. We know from the data that some people respond better to lutein and zeaxanthin than others,
Based on their own biology.
based on their unique biological factors. So clinicians are moving toward using genetic and biomarker guidance to tailor these regimens. Instead of one standard formula, your genes might say you need a higher dose of one thing over another.
That makes so much sense. So if someone is listening right now and thinking about this, let's give them the final, practical, step-by-step guidance.
4 key steps. 1. Before you buy anything, get a dietary and medical review. Identify your actual gaps and risks. Don't guess.
Step 2.
If your ophthalmologist confirms you're a candidate for AMD risk reduction, you need to seek out an ARDs2 compliant option. That means lutein and zeaxanthin and absolutely no beta-carotene.
Okay, 3.
Choose products with that third-party verification we talked about, USP or NSF. It protects your health and your wallet. And 4, if you're on these long-term, you must maintain ongoing monitoring with your healthcare provider.
That is extremely clear, actionable guidance. So we've defined this complex world, we've grounded it in the science of that ARDs2 substitution moving away from beta-carotene, we gave you that critical absorption tip. Take them with a meal, and most importantly, those quality signals to look for.
And remember, clinician oversight is just not negotiable, particularly if you're on common medications like anticoagulants or certain antibiotics. The interactions are real.
So here is the final thought for you to explore on your own. The research indicates that individual response to lutein and zeaxanthin is highly variable. It's dictated by baseline macular pigment density and, crucially, by specific genetic factors.
Which leads directly to the question of tomorrow. Given these rapid advances in personalization, how might genetic testing in the near future entirely change how eye care professionals recommend these nutrients? Will we reach a point where the standardized one-size-fits-all supplement recommendation is completely obsolete?